So today is part 4 in our lecture series on writing a systematic review. And so I'm going to skip down here, and I did put slides at the back today, okay, for you. Today is about getting your paper finished, and so by now you should have your plan written for your paper, know who your authors are going to be, you've made a commitment to write the paper, you have some time on your calendar to write the paper, you have your question. We talked about that, a good foreground question, okay, and talk about how that's worded. And then you have your search strategy outlined, knowing the terms and the databases that you're going to use in those searches so that your search is replicable by an editor, right? And you're going to use the search strategy to document your methods very clearly in the paper, and then also in your figure in the paper. So we have covered a lot of hello. Are you from one of the distant sites? Hi, this is Dr. Theeke. This is the systematic review workshop, just to make sure you're in the right spot if that's where you're trying to be. Okay, let me go to part 4. So today we're on part 4, okay? And I took a lot of time with the first parts of this seminar talking about your questions and your keywords and your search strategy. Today we're going to cover the rest of this, okay? And I'm going to give you again some tools if you're worrying about what journals should you pick, when is your paper ready to go, how do you know your paper's ready to go, what should you be getting from the literature, how do you synthesize that literature. So that's what we're going to cover today. I'll give you the best tips I can, and I'm glad to answer any questions that you might have. Okay, so I think we talked about this briefly at the end of the last session. I'm going to show you some tools here today, but you really, really need a system or strategy for documenting your search and making sense. It's not just documenting the search, but it's also making sense, hey, of the information in the search, right? So then you think about, we had some people in previous sessions said they get so overwhelmed. Well, you have to have a real strategy for making sense of the information that you're finding in the results of these articles after you've made all these decisions and you've decided what to include. So I can give you an example, like I'm doing this current literature review on loneliness and behavioral health outcomes in older adults, and so I have done this search and I have screened the literature, and I have 84 articles, and so now I have all those articles. So now I'm entering this next step. You know, I've decided that I had started with like 150, and I've decided these 80-some really probably will be included unless I find something in an active critique that means they shouldn't be included. You know, that if I see something that's I didn't see in the abstract or other information about the articles. So I'm actively engaging now in critiquing these articles one at a time. I'm recording it. It's no problem. These are like, a lot of these people were here at the last one, so they know who I am, and I said I'm here again. So we're good. We're okay. We're okay. So it's not uncommon if you're writing a very rigorous systematic review to have dozens of studies. Okay, and that's why, you know, I am writing the one I'm writing now with one other author, but it's someone who I know is reliable, dependable, and can work in a shorter time frame because it's invited to a journal, so I can't miss the deadline. But if you're not on a time crunch, the main thing is to make sure your paper is rigorously done and that you're very thorough and that you're covering everything so you get a good review from the journal. So in the past, I've written these reviews with maybe 5 or 6 people, and normally I would divide up those articles. You know, I'd say everybody's critiquing 10 articles so that I could see every author is in that literature critiquing it. And then we create, I'll show you some of the things we create to track the articles. So you want to have a system of recording your key information. A lot of people will use a formal critique sheet or a matrix to track the information. We might use a coding system, and I'll give you some examples of these. Because you can code your information based on what's important to you. You know, the topic of your review, what's important to you, what information you're trying to sort of gain from the review. So we'll talk about that. Okay, so coding studies. Reviewers usually develop a coding system that might even support some additional statistical analysis if you wanted to do a meta-analysis. But this is not something that you have to do. So typically what I would do An example I could give you from a coding scheme I've developed for the current review would be like I'm looking at studies that only do loneliness and behavioral health outcomes. So then I'm sort of coding those studies now, thinking about which studies report that loneliness is related to anxiety, which study reports that loneliness is related to depression. So I'm picking my key variables, things I know are important in the behavioral health field, and I'm coding it and categorizing the articles based on what's important in clinical or behavioral health right now. So the coding system comes from your current knowledge of the topic, and it comes from, you can often do a preview of 4 or 5 articles and think about, okay, what is it logical to start coding with this information? You know, what are the first 4 or 5 studies showing me that would have to be key variables or outcomes that are coded? Okay. So the first thing, when you get your literature, the first thing I think you should do is, if you're dividing it up, divide it up. But then if you do that, make sure all of your authors are critiquing it the same way, okay? So I always say first there's like the cursory sort of coffee cup review. That's where you get a cup of coffee and you sit in a chair and you read the article. Just do that and think for a minute about what the article is telling you. Then the next time you read it, get into your critique sheet and be like, okay, I know what these authors are generally telling me here, but you have to be persistently inquisitive. That's a characteristic of someone who's going to be a good person to write a critical review. And I'll see that in my doctoral students often. If I have a student who's very, very inquisitive, that's a great student to write a review, because they're going to ask questions while they're reading in their head. You know, they're going to be like, okay, well, what method did they use? And then they're going to think back, wait a minute, I had a lecture on that method. What are the limitations of that method? What are the potential biases that might be entered into a study using that method? That's that deep, persistent inquisitiveness that you want to have when you're critiquing literature, okay? So individual readers can use codes, but try to agree on what's important before you have individuals coding. Like, do a cursory review of 4 or 5 articles and have a meeting and be like, okay, it seems like most of the studies are, in my case, I would say it seems like most of the studies are relating loneliness to depression. So definitely we're going to want to track that. You know, how many are relating it to anxiety? How many are relating it to substance use? And then we're going to track that and code that. So when you think, it's really a thinking exercise. This is actually the hardest part of writing a literature review, because once you set all your other criteria that you've already done, like you pick your topic, pick your question, pick your strategy, that's when the real work begins, because now you've got to really think about what's going on in this body of literature, which is a body of knowledge, and then you have to think about how do you synthesize it for someone to read it and communicate to that reader what's really important in those studies, and then also then you're going to make decisions about where that knowledge should go from this point, you know, how to advance that body of knowledge, take it forward. So some use a formal critique document. I'm going to show you one here. When you're critiquing, you're really looking at strengths and weaknesses of the study, adequacy or inadequacy. You want to be unbiased, okay? You focus on a single study at a time when you're critiquing, because you don't want to get your thinking jumbled up with multiple studies. All right, and then just remember, for journal publishing, the article that you submit is probably going to be critiqued by multiple reviewers who have different perspectives, and we know that. There's some students here, but and so be ready to hear that peer feedback from reviewers, probably from different disciplines as well. And just, okay, so this is a critique sheet that's widely used, and it's published in a nursing research textbook right now, but I mean, it's just a basic critique sheet. It's, let's see if I can read it here. Yeah, copyrighted by that textbook, but you can use this to critique your literature, and it shows really the different questions you should be asking yourself when you're critiquing an article. You know, they're detailed questions about the design of the article. What type of study is it? You know, I don't want a student to just tell me, well, that's a quantitative study. Yeah, now, okay, that doesn't tell you much when you're thinking about there's a lot of different quantitative methods, right? You want the students, or if you're writing, you want to be able to say, you know, it's a longitudinal, prospective, quantitative study, you know, that kind of more detailed thinking when you're describing the designs. Because what you're going to want to do in your synthesis is you're going to want to critique those methods and think about one of the things I have a hard time getting people to think about is when you're moving knowledge forward, you want to move it up that pyramid of evidence too. So one example would be like in 50 years of research on loneliness, like 80% of the studies were descriptive, cross-sectional, quantitative studies. They're pretty low on that evidence hierarchy when you're thinking about a problem that you might want to intervene with. So if all the studies you're reading are basically descriptive, then you've described the heck out of something, but you're not moving the body of evidence forward so that we can do something about the problem clinically. So some of the conclusions then in your paper might be, 50% of these studies were descriptive studies without moving to intervention work. Or if they're intervention work, maybe they're intervention work without moving to comparative effectiveness work, right? So we might know a lot about individual interventions but not know which one is the best. So think about that. I'm going to answer questions at the end because this is recording. So, and then when you read these studies, I can't tell you how many studies I've read and critiqued. It's been a few that I actually find inconsistencies between, like think about the study from the very beginning when they write about it. What question are they asking? And did they actually do the stats analysis to answer the question in the publication? You'll find some inconsistencies in papers where, they'll say at the beginning the question is this, but then perhaps the stats methods don't actually really answer the question the way it's worded. That's a real limitation in a study then. You have to start thinking about why would they report those stats then if it wasn't part of the original research question or hypotheses. Okay. Sorry, I have a little cold, so I'm choking up here. All right. This form, I have it in an image, but I could send it out in a PDF or something if that's helpful to people. So what I have colleagues and students do is I use a matrix typically to organize my data. And so I'll show you an example of a table here that I usually create with the key things I put in a table when I'm critiquing literature. And oftentimes, when I'm publishing a systematic review, I include one figure. I almost always have a rule for myself, which is one figure, one table, unless I have a good reason to put something else in. So I always have the figure about the lit searching, and I always have a table with the included articles, always, because it shows the editors and peer reviewers of that journal that I have been in that literature and I've critiqued all those articles. Now, they don't all want to publish a 20-page table. I know that. But I have had, interestingly, I had one editor that published the table in the middle of my article, and it ended up making my article like 30, 40 pages long. And then I had another one who just linked to the table online for people that wanted to read the article and then maybe wanted to see the individual studies. So it was like a supplementary piece of material that people could have access to online after the paper was published. So there's different things that editors will do with these tables. So it's not necessarily just a cumbersome table you're developing that won't get published or seen somewhere. So it's important to know that. So this is the basic table. This is from the paper I'm working on now. This is, I didn't limit by time, so I'm going way back in the years. But I always have the year. I try to have the author, sometimes the title. Actually, I'm sorry. This is a paper that's submitted to a journal. So this is a paper I wrote with a clinical doctoral student that's submitted to a journal, and it is actually, the journal wanted this, they gave us some feedback, that specific journal wanted this format. So a lot of times I'll also have author, year, country in the first column, because I like to look at where the problem's being studied as well, because we all have differing healthcare systems. So to me, it's interesting to see what countries are studying the problem, but this journal said this is how they wanted this table. So this is the information that's there. Usually the purpose of the study, a brief description of the sample, the study design with specifics, okay? And the student was pretty good at honing in on the study designs. What measures were used? That can be very helpful if you're writing a systematic review on a specific phenomenon, is because from systematic reviews, readers not only learn about your phenomenon, but they do learn things like how many different measures there are to measure that one phenomenon if you've done a good review. And then what the findings are, and then some comments we had about the findings. Okay, so I know this looks a little crazy, but I did want to share it with you. This is how I do my literature, okay? I do my literature in a data file because I believe when you're doing a systematic review, your literature is your data. And so when I read a new article on loneliness, I add it to my SPSS literature data file. I come up with the variables based on what I think is important related to the topic and also patterns I see in the literature. So this has been, I've presented this a couple places and it has been exceedingly well received because if you put your literature in an SPSS data file, like for example, I know it's hard for you to see, but like I could pull out reports out of this and I could tell you how many articles each author wrote. I could tell you this is the primary discipline of the first author. This is how they define the main concept of loneliness. So I can tell you how many articles have been defined with a social emphasis, psychological emphasis. But then the other thing is when I go to synthesize my findings, I don't have to count anymore because I can tell you like over here I can tell you like there are this many articles that say yes, they equate negative psychological problems with loneliness or negative physical problems with loneliness or so I determine the variables in SPSS, but I can also generate charts. And one of the best ways I got funded by Robert Wood Johnson was because I put a chart up at a regional research conference that showed the 50 years of descriptive work and that there had been no intervention work. And when you put that in a pie chart and you show how many studies there are, and you show only like 2 people tried social interventions for a problem that we're saying is a major predictor for depression, which costs billions of dollars in healthcare, then people start to listen. But this SPSS lets you do some graphs and charts for people so they can not only read about what's in the literature, but they can see the literature. They can see the body of literature and they can see how the studies have changed or haven't changed. So this has taken some intense work, but for me it has been worth it. And I think it's something to consider if you really want to develop expertise on a topic over time, because once you have the SPSS data file built, it's super easy to like critique a new article when it comes along. And if you set up those alerts in the library system for, when something new comes along with your search terms, then you can just add it to your data file and it helps you to stay current. And then what I do is if a new variable comes along, like some of the inflammation stuff, well then I had to add it at the end. But I already knew that none of the first 50 articles I read had that in it. So I could just put no for those and then put yes for the other ones because I had already critiqued those articles. So it's something to consider as you work on your literature. And this kind of data too would lend itself to, if I had a few more variables in there with some physical measures, probably to meta-analysis at some point. So. Okay. So this is what I was talking about with the methodological features of the studies that you review. This is so important because we do tend to get stuck. I think people read literature and we don't realize sometimes how similar our population is to other populations. And, if we've already studied something in 5 populations of disparity, the question would be, do we really need to study that again in Appalachia? Or could we move that work forward knowing how similar our population is to that population? And so just thinking about the methods that have been used and seeing if there are flaws in the methods, or if you want to redo a study, sometimes we'll be like, well, I could redo that study here. There's a lot of that goes on. Just have a good reason for redoing that. Think about, well, were there flaws in the method that you would correct if you were going to redo it? Or, what is really your reason before you get into that? So the other thing to be careful of when you're finishing your paper for publication is logic flow. I see this a good bit with very junior students, is that they read all this literature, but then when they get to the conclusion section or discussion section, they tend to make a lot of really broad, general inferences that are really not logically inferred from the studies that are included in the paper. Okay? So like if I find out that 50 studies show that, loneliness predicts depression, or if I find out that, there's 50 studies, I don't know, that childhood trauma leads to adult depression, that doesn't mean that I can say for sure that if we fix loneliness, like no adult will get depression, things like that. And students will often write in that way. They'll write some broad sweeping inferences and have to bring them back down to think really carefully about what you read and the methods that were used and what can you logically say that makes sense, that moves the work forward but isn't so broad that you get a review back that, you know, I've had those reviews come back before that are like, you can't really say that. I mean, you don't have the evidence for that, you know, for that broad sweeping conclusion. It's a good place, though, to dream a little bit when you can make some logical inferences about where future work should go and put some ideas in there. You know, you can do that. You can say, well, based on these studies, this is where the work should go, and these are the methods that we still need. And then you could bring in maybe some new ideas, but then just frame it in that way, that, you know, potential implications for future research could include these types of studies, or potentially because of this finding, we should include these other variables, something like that, and make sure the reader can see how the inferences are logical. Okay. So, you know, the SPSS file helps me so much with this, detecting patterns, regularities, inconsistencies, gaps. You can do the same thing with your matrix or your table, but then you're really relying on yourself to do that. You're going to do a lot of hand counting and, you know, thinking that maybe SPSS could do for you if you went ahead and put the same literature in a data file. So it depends on how many studies you have. You know, if you have 20 studies in a table, it's pretty easy to see patterns. You know, 20, 30, you can see the patterns. A lot of times I'll print the table and I'll put it up on the wall in a big, long, hanging document so that I can really like visually see patterns in the columns. But if there are like 80 articles, you might need a data file to recognize patterns, because it's, you know, your brain can only take in, you're going to miss things. So your brain can only see so many things. And so you might not see all the patterns or gaps that a data analysis would see. And it doesn't have to be a complex data analysis of numbers. You know, it can be those categorical variables. And where are the gaps? Gaps in methodology and other things. So. Or gaps in sample. For mine, I saw the gaps in different samples. So for example, on this one, my phenomenon, I really began to realize, like, even though it exists across the lifespan, there's this very small bodies of literature on, like, kids in foster care and preschool kids and kids who get bullied in school and new mothers and freshman college students are very small numbers of studies. Most of the samples are old people. So it helped me to say, you know, this phenomenon exists in these other populations, but we seem to have an over-focus on one age group whenever we, you know, if you want to prevent depression, it often occurs 3 or 4 times in a person's lifetime. We need to be maybe moving that down to some of the younger age groups. So some of those things I saw that, I don't know, I guess I might have seen it. I'll say I might have seen it. I might not have seen it if I hadn't put it in the SPSS. So when you're summarizing and synthesizing your findings, just remember the whole purpose of everything you're doing is to synthesize these findings and get it out to that audience so they can learn something from all this hard work that you're doing. So when you're writing you write your results section, and you're going to write your discussion section. Let's see if I can find that model here again. So in the results, you don't want to have overlap in those two sections. Results are not the same as discussion, okay? And I see that happen a good bit too. And I give that feedback a lot to students. It's like you're restating results in the discussion section. So try to write each section and stay, I don't know where my little model went now. Let's see if it's here. I lost my own model. Okay. Yeah. Okay. All right. Yeah. So this kind of ends with the results section. So when you're writing this paper, you know, this part over here is where you write the results. Okay, that's kind of your results section. You'll see that in the PRISMA guidelines. And in the PRISMA guidelines, it really gives specifics about what goes in each section. So that will be very concise. You know, it might say something like 84 quantitative studies were included in this literature review. And then it will say, you will go on and on. Start with general descriptors first. Like, 25 of the studies were conducted from the primary discipline of medicine and in the United States of America. And just give the reader a general overview of the literature, what you found, and then you want to go to synthesize those findings. And it might be like 35 studies identified, in my case, loneliness as a predictor for major depressive disorder in older adults. And then I'll cite some things, I'll cite some of those studies there. But when you get to discussion, discussion is about what the results mean. What does that mean? That's a little bit tougher, because in the discussion you're often relating the results back to other literature or back to clinical protocols. So in my case, I might say, even though we know that lonely older adults are 10 times more likely to develop major depressive disorder, the current United States Preventive Services Task Force only recommends that we screen for depression and not loneliness. And I would cite something about that. And I would talk about the national initiative on loneliness and what's going on now in the country. But it would be relating the findings back to current literature, current clinical practice, current clinical guidelines, maybe literature from other disciplines, but it's not going to simply be restating. And there's a real tendency, I have the tendency too, like in the discussion section, you kind of have a tendency to like want to restate the results. But you don't want to do that. You want to maybe use a little piece of the results as a lead in on a sentence or something. Okay? All right. I'm going to show you some other tools down here. Okay. There it is again. Okay, so we did that one. Avoid quotes, please. Avoid a series of quotes. Most editors don't want a long series of quotes in the paper. Avoid sequentially describing each study. You have already, I want you to think about, first of all, let's talk 2 things. One, think about how you should organize your studies in the table. That might differ. Okay, so like if you're doing the table and attaching it, for me in my current paper, there's so many studies, I'm organizing them chronologically because I think I'm going to be able to show lack of method development, and also chronological order is going to allow me to show some knowledge development over time. But you might have a different way to organize your literature in your table for a very good reason. Like maybe you want to put all the studies at the beginning that used a certain instrument, in your table, and you could do it that way. So just think about when you're writing your paper how you should organize the table so that the reader can learn from it in the best way. So that you're using the table also to make your major points about the paper. So you can vary that. Like there is no right way to do it. I will tell you the one thing I don't like that makes no sense to me at all is when people put their articles in the table by author last name alphabetically. That does not help your reader at all. When you put them in that table and you attach that table to your paper, I tell people table 1, chronological knowledge development of quantitative studies of, it's titled. And it tells them they're in chronological order. Or it might be like included studies ordered by use of loneliness measure or something, or by outcome measures. Maybe you put all the studies that measured your most important clinical outcome first or something like that. Let's see. Yeah, try to call this out to readers. If you find in your literature review, which you undoubtedly will, if you see you're doing your review and you see several studies that you think are just prime examples of the most rigorous way to do this research, or maybe the best designed study, then call that out in the results section to your reader. Let them know that there are several studies here that were super high level that they may want to read. All right. And you're going to definitely use the PRISMA guideline. We talked about that in the previous sessions, and it's available online. It's like following a recipe. You can't go wrong. Do what it says. You will not go wrong. Okay? All right, citation managers. We talked about this before. I sent you the library link before to that. The librarian, Virginia, remember in one of the other sessions, she did the library resource for us, and she has 2 tabs on that library link for EndNote and Mendeley. but you definitely do need to use a reference managing system. It will make your life a lot easier, and it will also, I think, make it more likely that you're going to write another paper too, because you'll already have that built. So it's a tool you'll have then, and you'll have all your references in there, and you'll be like, oh, well, what can I write next? Or when you're writing your grant proposal, and you're writing those other lit reviews we talked about at the beginning of this workshop, like your mini lit review in your grant proposal, or your mini lit review in the beginning of another paper that you're writing about the same topic, you'll have that reference managing database, and it'll be easier for you to write those smaller reviews and get your citations in there. And you don't know how it is so nice when you get a paper rejected from a journal, and you have all your references in APA, and you decide to send it to another journal that takes a different format, and all you have to do is open up your paper and go EndNote, change format to this, and all your references are reformatted, and you send it to the other journal. So it's so nice. It's a good feeling. It's a little bit of work up front, but it's a good feeling. Okay, this might be something new for some of you. Some of you may be familiar, but have you all ever used any of these journal author tools? They're like journal author. They're tools used to select journals based on the paper you're writing. So I'm thinking no. Okay. So I don't know if this will take me there. Okay, check this out. This is so good. The journal author name estimator. Okay, and like I can put in here, I'm writing a paper on loneliness and behavioral health outcomes in older adults. Okay? Find me, let's put this in here. Don't forget this. Because I'm looking for a journal that publishes reviews. And I might be looking for a journal with a high impact factor. Okay? And I'm going to say, there they are. There's their impact factors. Okay? So these are suggestions. If I could get in Journal of Aging and Health, that would be something. That would be really good. It's not going there. It's going to issues in mental health nursing. But still, that's because they already asked for it, and I think I'm in pretty good shape. But like Journal of Aging and Health, I review for them. That would be a very high impact journal, a nice journal, and have a paper in. Okay? So the other one is by Elsevier. And so you can put your whole abstract in there too, but I find that if you put the whole abstract in there, it searches with too many words, and then like it might bring up journals that are just irrelevant because your abstract can have all kinds of words in there that aren't necessarily important for selecting your journal. Elsevier has a new journal tool, Find a Journal tool, and so you can match your manuscript here, and it's a very similar process. So I can say like this. Okay, so that's what I'm looking for here. And then I can limit it if I want to open access, but right now I don't. Well, I got to put something in here. So we'll I'll put 3 keywords that I know are coming out in that literature there. It's hunting for me. I think it is. Yep. It didn't take this long yesterday, so I don't know why it's taking this long today. Probably because I didn't limit I could have limited to life and health sciences, I guess. Let me see. Maybe I'll try that. Maybe I'll try that. Let's do that together. We'll see. But I mean, it will also come up here soon, I hope, with a list of journals that would be, I tested the Elsevier site yesterday, that were very relevant to my paper, very appropriate for the kind of paper I'm doing. So the other thing I like about Elsevier as an organization, I hope I'm saying that right, is they have this thing they call Submit Your Paper Your Way. And so they aren't as, they used to be like super duper strict on formatting when your paper came in. And like if it wasn't in the exact format for their journal, they would kind of be like, go away and do that again, send it back to us. And it could be very, because you try to meet their author guidelines. But now they have this thing, Submit Your Paper Your Way. And you can submit it kind of I don't know, scruffy. Doesn't have to be perfect, which I like because it tells me, first it tells me that they are, they want to read, I'm going to see, I have to try it one more time. I'm going to read, they want to read the contents of the paper more than they want to know if you have the period or the reference formatted correctly. So I like that. And so I've been submitting some papers to this publisher for that reason. And it's a pretty pleasant experience overall. And they, of course, they have 1 million journals, so it may not work today. But it works sometimes. It did work yesterday. Let's just move it over here. I'll just check that again in a minute. I don't know why that's taking so long. Okay. So, you know, this is an important point. I think we had 4 or 5 students taking qualifying exams this week to move on to that doctoral candidacy phase of their education. And one of the main things people want to know is, do you own the literature? Are they in the literature? Do they know it well enough to move on and do a dissertation and have some expertise? So if you take the time to write this kind of review, try to stay with it. You know, usually literature reviews get updated every 2 or 3 years. That could be a nice second publication. And I mean, it's hard to do. It's just like if you do a large data set analysis. Like you'll do one and then people ask a couple of years later if you're going to do another one, right? Because they want to know what's happening on an ongoing basis. And they are some of the most cited papers. It helps you establish expertise, and people will come back to you with questions. And my large data set analyses and literature reviews are the most cited papers on ResearchGate. I get more requests for those than any other like paper or primary report of study that we've done. Usually it's a request for one of those 2 papers. So I think try to stay with the literature. Think of new ways you could design studies based on your literature reviews so you don't have to keep going back and studying new topics. And don't forget about our library help. And now I have the director of the library here. So I was just talking with her, and you know, this is that library guide I was talking about that Virginia did for us. This is for systematic reviews. It's not specific to Nursing 707. I'm going to have Virginia change that, I think, and maybe it could be a general link that people could use, because it's really not even specific to nursing. The whole site is about just developing a systematic review and using some of the tools available in the library. So I think use it as a reference. I'm glad to take emails or questions if you have any as you work on your paper. So does anyone, that's all I have for you today. Does anyone have any questions? Or good luck, I would say. And it's really been my pleasure to teach this workshop. So I hope it's been helpful to you as you go along here.